Thank you, Madam Speaker, and I thank the Honourable Minister for asking these questions. Madam Speaker, there's a whole range of information available on this question. I'll be very brief, as I intend to give a ministerial statement next week on this. Thank you very much. Firstly, Honourable Members, one of the public health programs within the ministry is the immunization programs, also known as the vaccination program. This is mostly targeted toward children and adults, and we believe this is one of the most successful programs we have. We work with WHO on this, with not only WHO, but our other partner, UNICEF. And we are, through this immunization and vaccination program, we are able to ensure that fatal and often disabling diseases such as polio, measles, just to name a few, is prevented through this vaccination. With the assistance of the Australian sector support program, Fiji is one of the first countries in the Pacific and the region to simultaneously implement vaccines for pneumonia, the rotavirus vaccine that is for infant diarrhea, and the HPV vaccine, the cervical cancer program. And as a result, we should be able to reduce the occurrence of common childhood diseases and prevent adult cancer among women. Madam Speaker, another program that is running quite successfully in terms of public health is focused on rheumatic heart disease, which is currently affecting 1 in 50 children in Fiji. We have been able to deliver optimally life-saving treatment to children and adults living with rheumatic heart disease, and we have increased our capacity to detect and manage new patients through introduction of new technologies and assistance from our development partners. As a result, the screening rates among school children has increased, thereby ensuring increased detection and prevention of advanced heart disease in children to prevent complications and possibly premature deaths. Madam Speaker, another is we're looking at home-based care and treatment advisors for NCD complicated cases who have suffered strokes and amputation, and this is looked after by our National Wellness Centre at Mataika House. Another program, Madam Speaker and Honourable Members, as part of the public health program is a tobacco control and enforcement. We have implemented various interventions that has significantly ensured reduction in the overall adult smoking prevalence rate in Fiji from 36.6%, this is according to the NCD STEPS survey, to 30.8%. That's a decrease of 5.8. We know there's a lot of work to be done in promoting awareness about the risks associated with smoking amongst our Fijians. Madam Speaker, another program is the Wolbachia project. In the morning we talked about dengue and how we can combat dengue. So the introduction of the Wolbachia project to control dengue, Zika and chikungunya is again another milestone achievement for our country. Wolbachia is a natural occurring bacteria found in many insects, and if introduced in dengue-carrying virus mosquitoes, stops the spread of dengue virus when bitten by the mosquitoes. This project is funded by DFED and will be initially piloted and completed in the Central Division by 31st December 2018 and then carried out to other divisions. Madam Speaker, these are some, and like I said, I will address the rest in my ministerial statement. Thank you.